Hello there, wherever you are, welcome to new sections of your program. It begins with a new topic, and I think it is quite important, this one we're going to discuss right now. So, welcome to the show. HTN, this is a term might not being known for many people, but here we means hypertension. Hypertension has become one of the big concerns in this era, and it's classified as a modern disease because of the people lifestyle. The only means for that thing that the HTN is difficult to be solved easily, unless scientific effort must be exerted hardly. So we're going to talk about this point and many factors that will be discussed and being exposed in order to find and figure out what that HTN, what's the definition for this HTN, what's the reason behind that, and what's the treatment for this point. Really, it's going to be a very nice topic to talk about it, but after this break we start out. Be with us. Welcome once again to the show, and it's my pleasure to have very dear inside the studio. I would love to give you Dr. Gassim Hamid Al-Shahir. Welcome to the show. How is it?
Good. You are welcome. At the start, thank you at having me at Kassla TV. My name is Gassim Hamid Al-Shahir, as you mentioned, and I came from a very far area from here. I'm from the west. In our country, I come to work here in to East, yes, working at Kassla teaching hospital. Thank you.
Thanks a lot for joining me inside the studio. All right, hypertension has become really very big concern, among different countries. It's not just like special in specific countries; it's become worldwide. So academically, we need to know what that HTN. The definition of HTN.
Okay, as you mentioned, really hypertension is a big problem worldwide today, and HTN is primarily disease that affect the heart and the blood vessels. And we have to know, basically, under normal circumstances, our heart are continuously beating in against pressure created in the vessels to deliver the blood with oxygen and nutrient to the tissues, as well as to bring the waste product of metabolism there. This pressure, which I talk about it, under normal circumstances, 120/80. This is the pressure against which the heart or our heart beating in order to deliver the previously mentioned component of the blood to the tissues. Okay, if we measure this pressure precisely in two different situations. We found it 139 as the upper limit, and the lower limit 89 as systolic and diastolic. We call this patient or this person is most probably to having the disease. It is defined as hypertension. The normal limit of blood pressure is 120 systolic and 80 diastolic. I mean by systolic, the pressure against which our heart to have to contract. Yes, this is resistance created in the vessels. And diastolic, when the relaxation takes place. Okay. In two occasions, if your blood pressure persistently elevated, not exceeding 140, 179 in the systolic and 89 in the diastolic. We call this person is having an hypertension.
Okay, all right. And now I think people understand when we're talking about 120/80, and that's for contraction, when the heart gets contractions.
When get relaxed.
So the pressure getting that level. And in the relaxation, it is around 80.
Drops.
Okay.
80.
Okay. So what are the causes behind the HTN?
Okay, although nowadays it's a big problem and the science is continuously evolving in order to find what's actually making this a big and trouble problem. Most of cases are universally no established cause for hypertension. Over 95% of cases, science still now don't know what's the actual cause behind this. Why these people having a high blood pressure? Don't know. In the little 5%, there is a causes.
Okay, okay.
To be clear, little show.
Okay, the classification. Is there any types of the hypertension, and what that classification is so?
Okay, hypertension is broadly classified into two categories.
Okay.
The first category is the primary hypertension. I mean by primary, no cause can be established, as I mentioned, and secondary represent 5%. In 5% of person who having a high blood pressure or hypertension, we can find possible identifiable causes for why they have a high blood pressure.
Okay, and
not only that, but furtherly, hypertension is subclassified into other categories. We have the pre-hypertensive state. I mean by pre-hypertensive state, someone, if you remember, I said the systolic blood pressure 120 and diastolic 80. If you come to the clinic and we measure your blood pressure and we find the systolic limit of your pressure is 139, above 120, less than 139, and your diastolic is more than 80 but less than 89, we call this pre-hypertensive state. I mean, you are at great risk of having the disease. You are not having the disease actually, but you are prone to develop or to get the hypertensive state. And this type, it needs no treatment, just to reassurance, to make alarm yourself. You will get help.
Be careful.
Be careful. Yes. We have other categories for hypertension. We call it hypertensive crisis, and this is further subclassified into hypertensive urgencies and hypertensive emergencies. I mean by hypertensive urgencies, you having a very high blood pressure, but you having symptoms. I mean, you didn't complain from headache, blurring of vision, the classical symptom of H10, and this is usually result from under control of blood pressure. You have very high, but you neglect it. You don't control it. You don't go to control blood pressure. And the second category, hypertensive emergencies, this is, we call it this hypertensive state. You have very high blood pressure accompanied by symptoms. I mean, the disease has been started to reflect itself on you.
Okay, and among the people who are more exposing to have hypertension, in making comparison, I mean, men, women, children, who are more exposing to that thing?
I mean, I think your question is centered around what are the risk factors. What is the description of someone who's having the disease?
Exactly.
Yes, actually there is a lot of risk factors contributing to hypertension. I mean, they make the person more vulnerable of having the disease, and among these, the most important one is cigarette smoking is a risk. Also, obesity. Obese persons are more likely to have high blood pressure and hypertension to develop it. Also, those who have taking or having diet which are rich in salt. All these factors. Also, there is family factors contributing to hypertension. If your family,
like, it is able to be inherited, you know, by genetics.
Yes, if this disease running among your families, your fathers, your mothers, there is a possibility of having disease in your descent, your family, and so on. Also, there is a lot of science now. They talk about the genetic factors of having hypertension.
Well, that's very, very, very. It is really very panic. All right, let's come to the symptoms, and maybe the complication could take place among the HN. So, what are the symptoms on hypertension?
Okay, in general, no symptoms is specific to point to this patient or this person having HTN, but there are a constellation of symptoms presented represent the symptomatology of hypertension.
Yes.
They are not specific, as I mentioned, such as having severe, unusual headache, having and palpitation, chest pain. This is alarming signs of having the disease. So if you feel such symptoms, you have to check your doctor as early as you can.
Is it for me? I'm okay.
By the way, we have a lot of registered cases for hypertension among the young persons.
Oh,
Yes,
come on, you make me afraid.
possible.
But actually, really, from what I understand, really, you give me very information about the hypertension, because many people that I met, think that, hypertension could happen to men more than women. That's what I thought the first time, and actually, what you said, yeah.
Okay, it depends on these previous factors. If they are collected together on you or on her, she will have the disease.
Okay.
It's not a matter of being male or being female.
Yes,
Yeah.
exactly. Because when we come to the children, and I think this is something could happen, it is physiologically something normal, because their heartbeat, it seems more than the adult and the young people.
Okay, this is a very important point. You have to forget it as your age get advanced. The risk of having the disease also increases.
Yeah, for such a reason, like the lifestyle, smoking cigarettes, maybe getting lazy, overweight, obesity, and so on. Okay. For sure, when hypertension comes, maybe there is other diseases has linked and connected to the hypertension. So what that disease could happen because of the hypertension?
Okay, we have to know that hypertension is a systemic disease. Many organs in our are get to be involved in this process. It is a systemic process. Among these, we have your brain will be affected, your eyes will be affected, your kidneys also will suffer from this very high blood pressure. But at the beginning, all these organs start to resist this very high blood pressure, and if you didn't control it, they eventually will fail and the symptoms will appear. For example, we have in the brain small fragile blood vessels don't tolerate this very high blood pressure, so they may rupture and bleed in the brain. Patient may present with even a stroke, become paralyzed. Take care. Hypertension can cause stroke, you become paralyzed. Also your eyes, your retina is a very thin layer and very sensitive layer in our eyes. Also we're going to be affected by this very high blood pressure. If this is small blood vessels supplying it don't tolerate this high pressure, you rupture and you become eventually blind. It's very difficult. Also your heart, as I mentioned, it beats against a pressure.
Yes.
So if your heart is continuously beating against pressure, it will fatigue, it will tire.
Of course.
It will tire, and its chambers or muscles will going to be atrophied and dilates and eventually fail to pump this blood toward your organs.
And maybe some bruise got taken and some tear and wear, I don't know, the tear and some cutting down, the rupture of the soft tissues inside the heart, and could happen.
Yes, it could happen.
Making a lot of such like this thing.
Yes. Also your kidneys start to suffer and will fail. It will eventually ended by chronic renal disease, and it is another disaster beyond the hypertension.
Oh, doctor, really, this is so frustrating and
really
really
dangerous.
so terrifying thing. Okay, let's back to the diagnosis of the hypertension. So how can be, what the diagnosis methods that can be used in order to figure it out? All right, this is hypertension, other people make careful.
Okay, hypertension is largely diagnosed on the clinical ground, but there is another supportive methods of investigation. We use it as a routine in order to figure it out, and this including an ECG. This is recorded graphing for your heart to know what it extends or how your heart start to suffer.
Yes.
Also we use urine, analyze the urine to reflect the status of your kidneys, suffer or no. And also we do investigate the eyes by fundoscopy to see how far its function is preserved or not. Also we have to measure the lipid level and triglyceride, as it affects the vessel diameter, and this will increase the problem further and further.
Okay, please, could you please just help us and give us a treatment for the hypertension? So what's the treatment for this one?
Okay, the treatment at first should be as an early stage, and the goal of that is to preserve the function of your cardiovascular system and your kidney in an early stages. They are very vital organs in your body. We don't need them to be damaged or lost. So the aim of treatment is to prevent this vital function of these organs. The treatment at this point, I would like to stress on the most important aspect of treatment, which is lifestyle modification. I mean by that, you have to fight the sedentary life behaviors, such as staying for a long time in front of TV, become physically less active, also spending a lot of time online chatting. It's all we call this sedentary life activity. Also, we have to reduce the intake of salty diet.
Yes.
All this behavior, beside being stick to your advice of your doctors, taking your medication regularly, we make be able to make a good control over this very serious disease at early stages.
So, you know, the first line for change the journey of HTN away of our life is change the lifestyles.
Yeah.
Like, as if you give a message or a sign for people for stop smoking who you know,
extensively smoking.
Whom reach, I mean, they smoke so much cigarette, you know, all the time. They depend on their foods, you know, salt and such things, and never get any benefit from eating so much of the vegetable and fruit. And I think the first thing that you need, you know, to change the hypertension, it is to change our lifestyle.
Yes.
Okay. Yes. You know, I'm also working here in a hospital in Kassla Education Hospital. So, how do you describe the rate of the patient with the hypertension that you receive? How do you describe it?
Okay, unfortunately, the rate of hypertension is dramatically increasing, and something not good. Every now and then we see a lot of cases of HTN, and they come to us, or they brought to hospital with an advanced stage. They usually brought with complications. They don't care about this serious disease. Someone getting the disease for a long time, but when he feels that he is so ill, then he will come to the hospital, and it is increasing all over the world, as I mentioned.
Yes.
And it is, let me give you figures to reflect how far this disease is dangerous and increased, not just here in Sudan or in Kassla, worldwide, around 1 billion. This is the worldwide prevalence estimate of HTN. 1 billion. 7.1 million are the annual deaths from HTN. So it's a big problem. It's an increasing problem worldwide, not just here in Kassla or in Sudan, you know.
And really, that's very, very, very big issues. And that's why, as I said in the introduction of this show, you know, we need to double our efforts scientifically, and we need to research more and more in order to find a very chronic solution for this matter. And actually, it is easily, you know, can be found some solution for it. But the difficult thing that because it's connected with the people lifestyle.
Yes.
And which is the hard work here. It needs to be done because, you know, I've been for a long time that I smoke cigarettes. So when I decide to give it up, it's not something easy like drinking water, unless I have very strong determination inside and I realize really something dangerous and risky for my life. So when I need to stop in this point. All right. So just in very, very, very quick because we are out of time. What do you think? Is any drinking coffee? Because here in Kassla community are so famous for drinking coffee. So what do you think? If there is any relationship with the hypertension?
Really, I have no scientifically supported data about this point, but I think it's contribute to the increased risk of hypertension. As generally in clinics, we advise patients just you have to avoid drinking coffee.
Yeah,
have to avoid drinking coffee.
This is so happy here.
This is related to the stress.
Yes.
Stress. Stress also
reduce stress.
Yes. To
be
reduce
happy.
stress. Be happy.
Yes. Thanks a lot, Doctor.